Shocking. So I found that on this article, and we are going to be talking about it when we're off standby here. He's getting us going. So people will be shocked
Yeah.
to find out how much money we can save just in the United States alone,
Right.
if we all had primary care.
Yeah.
It's amazing. So, hey everybody, welcome to Healthy You. I'm Kim Martin, your healthy living expert, and today I have on our Healthy You show Shannon Lane, who is a nurse practitioner at Preferred Care Medical Center, and we are going to be talking about primary care. As we were just talking, Shannon, before we went live, we could actually save billions of dollars, billions, we're going to talk about this, per year in our country if we all had primary care. So I'm curious, how do you feel about primary care? Do you have a primary care provider? Do you see for regular checkups just to get those normal checkups on a routine basis? What do you think about that? I'd love to hear your comments. We'd love to see some love. Show us some love. Shannon says, I'm a little nervous. So show Shannon some love this morning. Let her know you're watching. Give us a heart. Give us a like. Post some comments, some questions. I know Shannon or Dr. Carey, you can come back later and answer those questions for you. So if you have any questions or comments, be sure to post those. We love to hear that. So let's just dive right in. So what is primary care exactly, Shannon? Help the viewers understand what primary care is.
So primary care is just your general health. So you see your physician or your nurse practitioner, and they do all the normal testing. Check your blood, check your, anything that will tell us is that you're functioning at a normal level. And we always want to get a baseline, try to see, if your blood sugar's a little high, anything like that, so we can kind of work on those things. And it will help you to be, if we see, oh, look, your blood sugar kind of went up a little bit, then we can say, hey, let's look at your exercise. Let's look at your diet. Let's look at those things to try to bring that to a normal level before you have to go to, using some medication. So it's a way to help your body kind of heal itself without
you can
using
find
those
some of
medicines.
those underlying issues.
Absolutely.
You said a word, baseline. And so that's what we need. That, I think, is huge when it comes to primary care, is getting that baseline. Now, it's October, and so it's Breast Cancer Awareness Month.
Right.
It's a big time that we need to get our mammograms. They do the buddy check, and Susan G. Komen is out and about trying to, and the American Cancer Society, raise awareness of breast cancer. I mean, it seems like everywhere we turn, we know someone who is affected.
Absolutely.
And when you said baseline, it made me think, because when I had a mammogram, my routine mammogram, they talked about my breast tissue was dense. And so I had to go for further testing, and they gave me a sonogram and determined that for me, that was okay.
Yep.
And so that's that baseline.
Yeah.
So if I didn't have that, now I don't have to go through an ultrasound every time I have a mammogram, because they have that baseline, and they go, oh, yep, that's normal for you.
Yep.
So do you have a baseline? Do you know what normal numbers are? Because how often do you see when you have a regular patient, Shannon, and then all of a sudden something is off? You're like, wait, this doesn't match up to what we've been seeing.
So normally, like yearly, we would do the blood work, check, just like I said, to see where they're at with their baseline. And if things are going up, then we're like, okay, is something different? Has something changed? Stress can cause a lot of that.
Yeah.
And so it's just a good time you can get to know them and talk about what's going on in their lives, and what's, if they've changed their diet, if they've changed their job, anything. And it will help, then we can say, okay, we need to look at these levels and see what's making that go up or go down. Or so we can you work with your primary care to figure out, and like I said, prevent those diseases and
Find them
illnesses that
early.
can come up. Yeah, find them early, and hopefully you can treat that, and it's not something that's going to affect you forever. It's not going to be a lifelong thing.
Yeah, and there, regardless of what we think, there are still tons of people. My mom is one of those people that does not do their preventative care.
Okay.
And preventative care and primary care kind of go hand in hand.
Absolutely.
Right?
Yep. So if you, for example, say you come in and I'm going to go back to the blood sugar. Your blood sugar is creeping up a little bit. And your primary care looks at it and says, hey, what's going on? What's different? And it could just be weight gain. It could be 10 pounds,
Right.
And so you can discuss that and say, hey, let's work on losing that, just walk for 30 more minutes or something a day. And you would be amazed at how much that helps with bringing those levels back into a normal level.
And it's motivation too, because a lot of times you think, 10 pounds, it's not that big of a deal. But when it comes to your blood pressure, your sugar levels, cholesterol,
Right.
and your resting heart rate and things like that, it is.
It is a big deal.
And so if you can see those numbers and you can see what was happening on the inside of your body when you were taking care of yourself, and all of a sudden maybe you've fallen off the wagon, and you can see what's happening on the inside of your body after, it's motivation to go, okay, that was working. Because you know what we find, and I bet you find this too, most people are motivated to lose weight or live healthy simply by the scale. And that's just what I am on a mission to change that mentality. Yes, we need to be a healthy weight. There's no doubt about that.
Right.
But that scale really it shouldn't be what motivates us.
Right.
There's so much more
Right.
to living a healthy lifestyle. In fact, so this is what I found online, and I'd like for you to speak about this. It says adults with a primary care provider have 19% lower odds of premature death.
Yeah. Again, it goes back to knowing your patient and knowing what they, where their baseline is and if something's changing. You can check cardiac levels, you can check cholesterol, all of those things. And those things are things that would could cause premature death. If you've got high cholesterol, you want to work at bringing that down. You want to try to get all those bad things filtered out and replace it with the good things.
And
So
there are no symptoms of high cholesterol.
No.
You don't know if you have high cholesterol unless you have the blood work done.
Right.
And high cholesterol causes what? What's the issues that come from high cholesterol?
You're basically it's forming that, closing up those arteries that go to your heart.
Right.
And if you close up those arteries that go to your heart, then you've got way bigger problems.
So heart attacks, strokes.
Yep.
I think isn't high cholesterol is a silent killer, really.
Absolutely.
And people go to bed and have a stroke and don't wake up.
Yep.
Or wake up and you've got some serious issues. So it is good to know if you have high cholesterol. There is so much you can do about it. And you don't have to, some people are like, I'm not taking medication. I refuse to take medication. You can take supplements.
Yes.
There are good quality supplements that you can take if you're on the border of being a little high that can help reduce, like omega-3, those omega-3s that are found in fish.
Yep.
You can take those supplements and help reduce your cholesterol.
Yes, absolutely. And that's, people are like, well, I eat a lot of fish. Well, the fish, a lot of fish that we buy is not, it's farmed.
So eat wild caught fish.
That's right. And it's hard to find in Central Illinois.
It really is. You got to really search.
Yeah.
You have to ask when you go out to the restaurants if it's farm or fresh, wild caught, and you have to read it on the label at the grocery stores.
Absolutely. So those omega-3 supplements are a good option for people in this area to get
to help reduce cholesterol. So there are things that you can do that don't necessarily entail taking medication, right? So some people just have that issue with that. But again, it goes back to that preventative care. And so when we talk about preventative care, we talk about saving money too. So guess what? If you get primary care, this says on here, you're going to save about 33% more in medical expenses than those who don't.
Right.
And why do you think that is?
Well, people that don't have primary care typically will use an ER or even like a prompt care type place for primary care.
Right.
They'll get sick and they'll come in and they'll want an antibiotic, and then you don't see them again until they're sick again.
Right.
So
we were having that conversation before we started this live show about using the ER as your primary care provider. And maybe that's you. If you're watching, is that what you do? Use prompt care and ER for your primary care. So if you get an ear infection or if you feel like there's something definitely wrong, you go to the ER. But there are some there's some issues that could affect you with that. If you go to the ER, you're probably going to be waiting a while.
Right. Quite a while.
and not knocking the ER. That's because they are an emergency room. They are taking care of people who are potentially dying, who maybe were just in an auto crash or having a massive heart attack.
Right.
And so if you have something of a migraine headache, which you might feel like, not knocking that, you could feel like you're dying.
Absolutely.
I've seen people with migraine headaches and it feels that way, but the truth of the matter is that's not an emergency over someone who really is dying.
Right.
And so you may be sitting there, where if you had a primary care like Shannon, right?
Right.
A nurse practitioner, you can call and get in.
Yeah. Yeah. I mean, in our office, I know some offices don't have this, but we do have on most days spots where you can call and say, hey, I see Shannon, I'm not feeling very good, I want to come in today, and they can usually work you in.
Sure.
To get, and that's perfect. That's exactly what we want people to do.
You guys have locations in a few different places, Preferred Care Medical Center. So those locations there's one in Peoria and Junction City.
Yep. And we have Eureka and El Paso and Roanoke.
Okay, El Paso and Roanoke. So if for some reason you live in Peoria and you couldn't get into Peoria, you could go over to Eureka. It's not the ideal situation to drive that far, but you've got those locations, so there's an opportunity.
Right.
But chances are, if you are seeing a primary care person, then you're not going to run into those situations a lot where you're just all of a sudden not feeling well.
Right.
I think that's the key.
That is.
I think it's like waiting till you feel like you've got one foot in the grave. And then you're rushing to the ER or to prompt care.
Right.
I know I'm guilty. Are you guilty? I will sit and I'm like, oh, I've got a sore throat, and then I'm like, no, I'm not getting sick. Let me drink my tea. Let me do this. And then it's like, Thursday or Friday. And then it's like, okay, maybe I have strep.
Right.
Where you could go get that checked out relatively quickly and not wait until the last
True.
minute.
I mean, the prompt cares are wonderful for, especially for the weekend.
Especially weekends, yes.
You've got to, if your primary care is not available and you want to get into a prompt care, you can go there and you can say, hey, my primary care doctor is whoever, and they can send those records over. So at least you have them, in your record at your primary care office.
Yeah. What I love about Preferred Care is that you guys have everything under one roof. So you really can get most of your primary care right there in one place.
Yep.
What are all the things you guys offer for primary care and also preventative care?
So our primary care, we have, we can pretty much do anything. We can do the blood work. We can do any testing. If we feel like there's something else that, we need an MRI or something, of course, we send them to pretty much wherever they want to go. If they, if they want to go to OSF or Unity Point or whatever, we can send them there. obviously we keep the records, we know, and they'll send all that stuff back to us. So we get those lab results. We get
You
those.
know exactly what's
Yeah,
going
we
on.
know exactly what's going on. If you're in pain, a lot of people are like, oh, I just want some pain medication. But we have a ton of natural things, supplements and things we can use. We have chiropractors there that can help with, if you have back pain or you've been injured, any of that stuff. We have rehab,
Physical
physical
therapy.
therapy rehab for injuries and just, people that aren't functioning at a level they should be. We help, we all ages. We have some people that are just amazing to me that are like in their 90s that they function so well, and
They've aged well because they take care of themselves.
Yes, they just continue to, they come in and they do their therapy and they see our chiropractors and
even massage therapy.
And massage therapy, yep, we have that too.
All of that. And of course, the best part about your practice is you guys try to take care of things holistically.
We do.
That's your preferred method.
That is our
The preferred method at Preferred Care
Yep.
is a holistic approach. And that's what we want to do, because we do know that what you eat, your activity, your exercise, all of that is preventative care. And primary care falls under preventative care.
Yep.
So you want to make sure you're getting okay, so let's talk about the ages. So people, maybe you're watching, you're like, okay, I'm 35, what should I do? I'm 40, what should I do? I'm 50, what should I do? And talking to men and women.
Right.
So what are some of those primary care, preventative care tests that we want to have at those age brackets? Do you give us a guideline? I know it's a little different for everyone, but
So the blood work, I think, is important just to get, the CBC and check that out every year.
okay.
And that's for both. Check your, cholesterol, your just your blood count, all that stuff. And then as you age, mammograms come into to play. I still say 40.
Right. Is the general guideline for a mammogram?
I think they've kind of bumped it up a little bit.
Because we have so many young women being diagnosed with breast cancer. It's so scary.
Yeah.
And it's so but there are also women who maybe it runs in their family. You definitely need to back it up.
Yeah. Certainly you would do it earlier.
I got my first mammogram when I was 40. I mean, I didn't have anyone, no parent or grandparent or sibling,
Right.
had breast cancer. So I was in a pretty good statistic.
Right.
So I had my first mammogram at 40. But now you're saying maybe they're backing it up a little bit, and especially if your family members.
If your family members, if you've got a mom, sister, somebody like that that's had breast cancer, then they would do it earlier. 40 is what I've always been. That's where I'm like, okay, that's where you need to start having them every year.
Right.
But I think the American Cancer Society now is saying that they don't really have to start if there's no risk factors until later.
Oh, until later.
But I don't do that.
Yeah,
just
so-
because I feel like at 40 is a good.
And then they're also saying maybe you don't have to have them every single year as if you have them regularly. But again, it depends on the risk factors.
Right.
But you need to know those, and you can know those if with a primary care someone to take care of that and help you understand based on your risk factors what you need to do.
Right, because everybody's different.
Right. And so what about those guys out there? So we know women, we need mammograms.
Yep.
And then what about going and having colonoscopies and things like that?
So that starts at 50
Okay.
for both men and women, unless there's a risk factor again. Then it would start earlier. Prostate exams, men need to have those. And I believe that starts at 50. I'm not super sure about that, but I think that starts at 50 unless they start having problems. If they have, where they're having problems urinating or something, then they may do that a little earlier. And I think a lot of men have them earlier, just because at some point they've had some kind of
Right.
issue. So, and then, yeah, I mean,
Just getting that blood work.
Yeah, getting all the stuff so that
I
one
think
person can.
we can't say enough about making sure you have your blood work, those panels done every year so that you have that baseline.
Yep.
I think that is the most important thing.
It is.
Because if you have that baseline, then you can understand, okay, these are your numbers for you. And if you stay in that range, everything's okay.
Yeah.
But if all of a sudden something drops or something bumps way too high, it's so noticeable because you have this trend.
Yeah, then you can start looking at why, what's going on. Is there more, you can do more testing, you can do all those things, and you catch it early.
Sure. And again, having everything under one roof at Preferred Care makes it so easy. So if you're having some issues, obviously we want to do everything in our power to heal our bodies holistically without putting any foreign substance in there if we can help it.
Right.
But you also have the ability, you're a nurse practitioner, so you have the ability to write a prescription in the event that someone does need some medication to get them started.
Sure, absolutely. And if somebody comes in and we check them and they have strep throat, clearly, they need to have an antibiotic.
Right.
So things like that, yeah, we have that ability. I can, write prescriptions for that. And if somebody is adamant that they want to do something that's not holistic, we have that ability. We may discuss it and discuss the pros and cons of each thing.
Right.
And then that's the best, then they can make an educated decision.
Which is awesome to have those options. This is what we were talking about when you guys joined in. I read this. Now, this is what this website says. We'd have to do a little research to make sure it's exactly accurate. It sounds reasonable to me because what I did find is that the average person that has primary care saves 33% more money than someone who does not have primary care in medical expenses. The other thing that we know, and we know this is based on statisticians' reports, and we know those are people who are paid by insurance companies a lot of times to do the investigation, determine how much money we're spending and what insurance costs should be, right? So it's pretty good resource. And that is if you have preventative care, which primary care is preventative care.
Yeah.
No doubt about it. If you have preventative care, primary care, for every dollar you spend on preventative care, primary care, so that would be on your exercise program, your coach to help you live a healthy lifestyle, to eat well, to learn how to eat well.
Right.
Your visits to your primary care physician, whatever your insurance doesn't cost. Chiropractic care, massage therapy. Am I missing anything? All of those good, good quality foods, supplements.
Supplements.
Oh, yes. Hello. Let's not forget that.
Right.
Supplements, that would fall under preventative care. So for every dollar that you spend on preventative care, you save $5 in medical expenses long term. So many times people say, I can't afford to go because I have to pay a copay. I can't afford to work out. I can't afford to have a eating program. I can't afford. But ultimately, ultimately you've got to see it. That's, again, that comes from the statisticians. And so that's a very reliable resource. You have to believe and know for sure that when you spend money on preventative care, you're saving money.
Yeah.
In the long run.
Yeah. It's an investment in your life, basically.
You're investing in your life.
Yeah.
And there's no greater investment.
Right.
Above anything. So many times I'm a mom.
Right.
You know, I have kids. I want them to do things that they want to do. But, you know, it's not going to do them any good if I'm investing all this money in their activities and have no money left to invest in me to stay healthy, to take care of them.
Right.
So that is no excuse. Spending all your money on activities on other people in your family and then you don't have any money left to take care of yourself. That is not an excuse.
No.
And it's not a good, it's not, you should not do that because
Right.
you got to be healthy and you've got to be able to take care of your family.
Yes.
And what do you think, you know, I feel like sometimes if we're not in pain, if we're not experiencing the consequence yet of that behavior, it's very difficult. Somebody might say, well, I'm not sick. I feel just fine.
Mm-hmm.
And how do you approach that with your patients?
So, I mean, yes, you feel fine, and maybe you are, probably you are. You know, if you're, you know, eating healthy, you're doing things, you know, you're exercising, then great. But you still have to have somebody that's looking out for those, you know, those things that might happen, you know, that could go wrong, that you may not even feel it. I mean, they say things like, you know, you're not going to feel 3 days before if you're going to have a heart attack.
Right. Well, you know, unfortunately, we just lost Tom Petty this week.
Right.
Massive heart attack.
Mm-hmm.
You know, at 66, that's young in this day and age. Because they're saying 1 in 3. 1 in 3 of us are going to live to be 100. That's what, that's the guidelines. So 66 is very young.
Yeah.
And you wonder, did he have any symptoms? You know, or did it just come on? Was he having, maybe he was, you know, maybe he had been seeing a doctor already, but we don't know that. I mean, I'm sure they don't go around telling us all their business. We like to think that they do, but they don't.
Right.
But you know, we could ponder, did he have a primary care physician? Did he have any idea that he was having any problems?
Right. Yeah. I mean, that's the thing. And primary care could recognize those things and say, hey, you know, we've got something going on here. Let's get this checked out.
Yes.
You know, if it's a simple procedure that they need to have done to help unclog an artery or whatever to save somebody's life, it's worth it.
It is worth it. And what we need, and I don't have all the statistics in front of me, but I know based on information I've got from Susan G. Komen, especially being that it's Breast Cancer Awareness Month, October, if you get early detection, you have it's more than a 90% chance of survival. I mean, come on. It's a terrible thing to have to go through.
Yeah.
You know, it's not to take away that experience, but fear that you're going to be diagnosed with something is the absolutely wrong reason not to have primary care, which is what my mom, she has that fear that something's going to be wrong, so she just doesn't go.
Yeah.
Do you think fear is a big factor?
I do think fear is a big factor. But I wanted to say this real quick. I just read an article last night that said deaths from breast cancer have decreased by 40%. I mean, that's crazy. It's, you know, there's just so much awareness, and there needs to be awareness about a lot of things, a lot more things, you know, heart disease and all of those things. And I think that we could make a difference in.
And the supplements that we need to be taking. I can't say enough that you need to be on good supplements. There are a lot of good supplements out there. You can do some investigation. You can come see our friends at Preferred Care. Dr. Carrie Musselman owns those 4 locations. She's awesome. She's on the show. And, of course, Shannon Lane is just one of her nurse practitioners. I want to leave you on this note. This is what we were talking about. We got a few seconds left here. This is what I read on here. If everyone saw a primary care provider, the U.S. would save an estimated $67 billion dollars every year. Do you believe that that's true?
I do believe that's true.
That is crazy.
Just a lot of money.
That is a lot of money. We are wasting our money on having to take medications because we're sick, because we're not taking care of ourselves. We gotta fix this problem, guys. Okay, so be sure to contact Preferred Care if you don't have a primary care provider, and tune in every Wednesday morning at 8 o'clock on Healthy You as we bring you information to help you live a healthier lifestyle. Enjoy the rest of your Wednesday. We'll be back next week. Shannon, thank you so much.
Thank you. Thanks for having
That's
me.
awesome. So I learned something today. I just can't believe that.
67 billion a year. You know, when we think
PeoriaLife.com